So thanks for the opportunity to talk about PROpel, a phase 3 randomized study in patients that unfortunately have very advanced prostate cancer, the metastatic castration-resistant prostate cancer, where unfortunately patients are going to progress and die quite quickly. Right now, we do have excellent standard of care with drugs like abiraterone and prednisone, but unfortunately patients progress quite quickly and eventually die. And so what we did in PROpel is we randomized patients, all comer mCRPC, regardless of HRR mutational status, and we randomized them to abiraterone prednisone, which is the standard of care, against abiraterone plus Olaparib. And we had already seen in the preclinic that combining these two agents might help to potentiate each one individually and have a synergistic effect. And a phase 2 study had suggested the same thing, that we were able to delay progression. And so what PROpel found was that we were able to significantly prolong radiographic progression-free survival, which was the primary endpoint, by over 8 months, which is almost identical to what we saw with abiraterone against a pure placebo. So really striking results, very exciting. And when we looked at the subgroups of the patients who came in, it really made no difference if they had visceral disease, they had clear benefit, if they had received docetaxel in the hormone-sensitive setting, which are very difficult patients to treat. The impact was clearly there. And most striking was it made no difference if they had a homologous recombinant repair alteration or HRR mutation or not. They benefited also to a similar extent as with the overall results. And so very exciting, especially that the combination really didn't lead to more adverse events than each drug taken individually. Quality of life was maintained. So we really think that with these spectacular results, we might eventually have, for the first time, a combination therapy to offer patients in first-line mCRPC, and really make a difference, especially that many patients don't go beyond first-line treatment in mCRPC, and we desperately need to do better when we have the biggest opportunity. Well, obviously, the next steps is there's a lot of data. People are asking a lot of questions. We'd like to be able to further inform the wider community to be able to make this accessible for patients. We're obviously looking forward to the overall survival results, which are still immature, which is a very good thing. Patients aren't dying more quickly than we would have expected, which is excellent. But we're already seeing a separation of the curves in terms of overall survival. So we're cautiously optimistic that this is going to, even though it's a very small study in proportion to what's already approved, that we're going to see overall survival improvements, given the fact that we were able to delay subsequent therapy and also delay second progression. So first, we're looking forward to the overall survival results, and second, continuing to work on the type of patients most likely to benefit, going beyond just HRR mutational status.